Welcome to Chapter 1 of the Retina BCSC. In this chapter, we will review the anatomy and physiology of the posterior segment, focusing on the vitreous, neurosensory retina, retinal pigment epithelium, Bruch's membrane, choroid, and sclera. We will discuss their structural organization, vascular supply, metabolic interactions, and functional relationships. Together, these concepts provide the foundational framework for understanding retinal function and the mechanisms underlying retinal disease. Let's get started.
Let's start off by talking about the vitreous. The vitreous is a transparent gel composed primarily of water, collagen, and hyaluronic acid. In addition to these structural components, it also contains hyalucytes, which are bone marrow-derived stem cells. The vitreous occupies approximately 80% of the total volume of the eye. It is divided into two main regions, the central or core vitreous and the peripheral or cortical vitreous. Moving on to its metabolic environment, the vitreous obtains oxygen through diffusion from both the choroidal and retinal circulation. However, most of this oxygen is consumed by hyalucytes. Therefore, the amount of oxygen that ultimately reaches the lens and the anterior segment is limited. The vitreous contains high levels of ascorbate. This high ascorbate concentration plays a protective role by guarding against oxidative damage.
In terms of the anterior vitreous anatomy, the anterior cortical gel contains collagenous fibers that attach directly to the posterior lens capsule. This attachment forms the Weger ligament, which plays a key structural role at the vitreo-lenticular interface. Continuing anteriorly, the patellar fossa is identified as a retrolental indentation of the anterior vitreous. This indentation corresponds to the contour of the posterior lens surface and reflects the close anatomical relationship between the vitreous and the lens. Adjacent to this region is the Berger space, which is a potential space located between the posterior lens capsule and the anterior cortical gel. This space is bordered by the Weger ligament, further defining the boundaries of the vitreo-lenticular interface. This slide focuses on the vitreous base and its anatomic relationships, with both text and a labeled diagram to illustrate these concepts. The vitreous base is a ring-shaped region that extends approximately 2 mm anterior to the ora serrata and 3 to 4 mm posterior to the ora serrata. It is a region with particularly dense collagen fibers, resulting in a firm attachment to the anterior retina and the posterior pars plana. In addition to these primary attachments, the vitreous base also has additional firm attachments to several key ocular structures, including the posterior lens capsule, retinal vessels, the optic nerve, and the fovea. The attachment of the vitreous to the retina occurs via the internal limiting membrane and is mediated by fibronectin and laminin. Structurally, the densely packed collagen fibers in this region form the cortical gel. Posteriorly, collagen fibers run roughly parallel to the inner retinal surface, forming the pre-retinal tract. The accompanying figure provides a sagittal cross-sectional view of the eye to visually reinforce these relationships. The vitreous base is labeled circumferentially at the peripheral retina near the ora serrata, highlighting its ring-shaped configuration. Anteriorly, the figure labels the zonules, anterior hyaloid, Berger space, and Weger ligament, demonstrating the close relationship between the anterior vitreous and the posterior lens capsule. This slide addresses the anatomy of the posterior vitreous, beginning with the premacular bursa, also referred to as the precortical vitreous pocket. The premacular bursa represents a prominent area of liquefaction within the premacular vitreous gel. It is located anterior to the site of posterior vitreous attachment at the macula and is believed to decrease tractional forces during ocular motion. The vitreous inserts at the edges of the optic nerve head, creating a funnel-shaped void known as the Cloquet canal. The opening of this canal at the optic nerve head is referred to as the area of Martegiani. The schematic figure on the right provides a sagittal cross-sectional illustration of the eye to contextualize these anatomic features. The premacular bursa is labeled anterior to the macula, demonstrating its position relative to the fovea and posterior vitreous attachments. The Cloquet canal is shown coursing through the central vitreous toward the optic nerve head, where the area of Martegiani is labeled. The lower image is an OCT scan of the macular region. In this image, arrows highlight a hyporeflective space anterior to the macula, representing a prominent area of liquefaction of the premacular vitreous gel. This corresponds to the premacular bursa and visually demonstrates the precortical vitreous pocket described in the text.
This slide introduces the neurosensory retina. We will first focus on the macula and the foveal region. The macula is defined as a central retinal area measuring approximately 5.5 millimeters in diameter, located between the optic nerve head and the temporal vascular arcades. It contains 2 or more layers of ganglion cells and accounts for approximately 50% of all retinal ganglion cells. Clinically, the macula has a yellow coloration due to the presence of the pigments lutein and zeaxanthin. Within the macula lies the foveal region, which is further subdivided into distinct anatomic zones. The fovea, labeled as region C on the figure, represents the central 1.5 millimeters of the macula and is specialized for high acuity and color vision. At the center of the fovea is the foveal avascular zone, or FAZ, which is devoid of retinal vessels and measures approximately 250 to 600 micrometers. The FAZ corresponds to the center of fixation and serves as an important landmark on fluorescein angiography. At the base of the fovea is the foveola, labeled as region B, which measures approximately 0.35 millimeters in diameter. The foveola forms the floor of the fovea and contains densely packed elongated cone photoreceptors. At the very center is the umbo, labeled as region A, which is defined by the central depression and represents the anatomic center of both the macula and the fovea. Next, we will focus on macular subregions and the peripheral retina. Within the macula, the parafovea, labeled as region D in the figure, is defined as a 0.5 millimeter ring surrounding the fovea. This region is where the ganglion cell layer, inner nuclear layer, and outer plexiform layer, also known as the Henle fiber layer, are at their greatest thickness. Surrounding the parafovea is the perifovea, labeled as region E, which forms an approximately 1.5 millimeter ring and defines the outer margin of the macula. Together, the parafoveal and perifoveal regions contribute to the layered structural organization of the macula as it transitions toward the peripheral retina. Beyond the macula lies the peripheral retina. The retina outside the macula is divided into several regions based on location. The near periphery is defined as a 1.5 millimeter ring located peripheral to the vascular arcades. More anteriorly is the equatorial retina, which corresponds to the retina near the equator of the globe. Anterior to this is the peripheral retina, referring specifically to the retina located anterior to the equator. This slide focuses on the ora serrata and its associated anatomic features. The ora serrata marks the junction between the neurosensory retina and the pars plana. The posterior border of the vitreous base typically lies between the ora serrata and the equator of the eye, making this region a common site for retinal tears. Several characteristic structures are associated with the ora serrata. Dentate processes are described as jetties of retinal tissue that extend anteriorly into the pars plana. In contrast, ora bays represent posterior extensions of the pars plana that project toward the retina. Another important feature is the meridional fold, which is a radially oriented prominent thickening of retinal tissue that extends into the pars plana. When a meridional fold is aligned with a ciliary process, this configuration is referred to as a meridional complex. The accompanying diagram provides a schematic illustration of these relationships. The ora serrata is shown as the scalloped transition zone between the retina posteriorly and the ciliary body, specifically the pars plana, anteriorly. Dentate processes, also labeled as ora teeth, project anteriorly from the retina, while ora bays appear as indentations between these projections. Meridional folds are depicted as radially oriented ridges extending from the retina into the pars plana, and when an enlarged ciliary process is aligned with a meridional fold, this defines a meridional complex. The diagram also highlights a pigmentary demarcation line and demonstrates the location of a retinal tear near this region, reinforcing the clinical relevance of the ora serrata as a common site for retinal tears. This slide introduces the organization of the retinal layers, showing their demarcations on both histology and OCT. Beginning with the H&E stain on the left, the retina is shown in cross-section from the vitreous side at the top to the choroid at the bottom. Starting internally, the internal limiting membrane forms the innermost boundary of the retina. Beneath this lies the nerve fiber layer, followed by the ganglion cell layer. Deeper layers include the inner plexiform layer and the inner nuclear layer, which are separated from the outer retinal structures by the outer plexiform layer. External to this are the outer nuclear layer and the photoreceptor inner and outer segments. The external limiting membrane is identified just above the photoreceptor segments. Below the photoreceptors lies the retinal pigment epithelium, followed by Bruch membrane, the choriocapillaris, and the choroid. The image on the right demonstrates the same retinal layers as visualized on spectral domain OCT. One thing to note is that nuclear layers look dark or hyporeflective on OCT because they contain densely packed uniform nuclei that allow light to pass through easily, while plexiform layers appear light or hyperreflective because they are rich in synapses and nerve fibers, creating a more varied, heterogeneous tissue structure that scatters and reflects more light back to the detector, acting like bright bands. A mnemonic to help you remember these layers is, in new generations, it is only ophthalmologists examining patients' retinas, which stands for ILM, NFL, GCL, IPL, INL, OPL, ONL, ELM, photoreceptors, and RPE. Just remember, plexiform layers come before nuclear layers.
Now, let's talk about photoreceptors. Photoreceptor density and distribution vary depending on retinal location. The two major photoreceptor types, cones and rods, demonstrate distinct regional patterns across the retina. Beginning with cones, they are most densely packed in the fovea, with a density exceeding 140,000 cones per square millimeter. Despite this high central concentration, approximately 90% of all cones are located outside the fovea. Cones are predominantly red and green sensitive. Within the foveola, cones are the only photoreceptors present, with an absence of rods. Moving away from the fovea, cone density decreases rapidly. In contrast, rods are absent in the foveola. A small area of very high rod density, approximately 176,000 rods per square millimeter, is present in the superior macula. Beyond this region, rod density gradually decreases toward the peripheral retina. Together, these distribution patterns highlight the specialized organization of photoreceptors across different regions of the retina.
This slide reviews the basic structure of photoreceptors, emphasizing that each photoreceptor consists of an outer segment and an inner segment. These two regions are structurally and functionally distinct, but closely integrated. Beginning with the outer segment, this portion contains stacked disc membranes that house vitamin A-derived photopigments. In rods, the outer segment may contain up to approximately 1,000 discs. These discs undergo continuous renewal, with older discs being shed and subsequently phagocytosed by the retinal pigment epithelium. Moving inward, the inner segment is divided into two main regions. The ellipsoid contains abundant mitochondria and plays a role in determining cone shape. The myoid contains the endoplasmic reticulum. The outer segment is connected to the inner segment by a cilium, which is anchored by neurotubules. At the junction between the inner and outer segments, specialized structures formed by cilia, mitochondria, and inner discs are present. This junction reflects the fact that photoreceptors are modified sensory cilia, which explains their vulnerability to ciliopathies. The accompanying schematic illustrates a cone photoreceptor on the left and a rod photoreceptor on the right within the peripheral retina. The outer segments, located more towards the bottom of the screen, are depicted as elongated structures containing membranous discs labeled as OS, adjacent to the pigment epithelium. The inner segments, labeled as IS, include the ellipsoid region with mitochondria and the myoid region containing endoplasmic reticulum. The connecting cilium, labeled C, links the inner and outer segments.
This slide reviews the basic organization of retinal neural circuitry, beginning with the connections between photoreceptors and bipolar cells. Photoreceptors synapse directly onto bipolar cells. Cones form a one-to-one synapse with midget bipolar cells, whereas rods demonstrate a high degree of convergence, with more than one and up to over 100 rods converging onto a single bipolar cell. The pathway then continues from bipolar cells to ganglion cells. Bipolar cells function as first-order neurons and synapse with ganglion cells within the inner plexiform layer. This synaptic organization allows bipolar cell signals to be relayed and further processed before reaching the output neurons of the retina. Ganglion cells serve as second-order neurons. They summate responses received from bipolar cells as well as from amacrine cells and generate action potentials that are transmitted to the dorsolateral geniculate nucleus. Amacrine cells, located within the inner nuclear layer, respond to specific alterations in retinal stimuli, such as changes in light intensity or the size of light stimuli. These cells modulate signal transmission within the inner plexiform layer and contribute to the refinement of visual information. The accompanying schematic illustrates these cellular relationships in a vertical cross-section of the retina. Photoreceptors, including cones and rods, are shown at the outer retina, synapsing onto bipolar cells. Horizontal cells are depicted providing lateral interactions at the level of the outer plexiform layer. Bipolar cells extend from the outer retina to the inner plexiform layer, where they synapse with ganglion cells. Amacrine cells are shown interacting within the inner plexiform layer, and ganglion cell axons course along the nerve fiber layer toward the internal limiting membrane. Mueller glial fibers span the thickness of the retina, providing structural support across all layers.
This slide reviews key retinal layers and the structures commonly referred to as intraretinal membranes. The inner nuclear layer contains the cell bodies of horizontal cells, bipolar cells, and amacrine cells. In contrast, the outer nuclear layer contains the nuclei of the photoreceptors. Moving more internally, the nerve fiber layer is composed of ganglion cell axons, which collectively form the optic nerve. It is important to note that intraretinal membranes are not true membranes because they lack a basement membrane. The inner limiting membrane is formed by the footplates of Mueller cells and is attached to the posterior cortical vitreous. The external limiting membrane consists of zonular junctions between photoreceptors and Mueller cells and is visible on optical coherence tomography. The middle limiting membrane represents connections between photoreceptor inner fibers and bipolar cell processes and is also visible on OCT.
This slide reviews the vascular supply and oxygen delivery to the retina. The inner retina is supplied by the retinal circulation, primarily through the central retinal artery, which is a branch of the ophthalmic artery. The central retinal artery enters the eye and divides into 4 major branches, with each branch supplying a quadrant of the retina. In contrast, the outer retina, which is defined as the outer plexiform layer outward, is supplied indirectly by the choroidal circulation. An important anatomic variant is the cilioretinal artery, which arises from the ciliary circulation rather than the central retinal artery. The cilioretinal artery supplies part of the inner retina, including the macula, in approximately 1/3 of eyes. Its presence is particularly beneficial in cases of central retinal artery occlusion, as it can preserve macular perfusion and function. The accompanying fundus photograph illustrates this concept clinically. The image shows findings consistent with a central retinal artery occlusion, with diffuse retinal whitening. Despite this, the macula appears relatively spared due to the presence of a cilioretinal artery supplying the central retina, demonstrating the protective role of this vascular variant. This slide further details retinal vasculature and oxygen supply by describing the layered organization of retinal blood vessels. The retina is supplied by up to 4 distinct layers of vessels. The radial peripapillary capillary network is located within the nerve fiber layer surrounding the optic nerve head. This network is particularly prominent in this region due to the high density of nerve fibers. Moving outward, the superficial vascular plexus includes the superficial capillary plexus within the ganglion cell layer. Deeper within the retina is the deep capillary complex, which consists of 2 capillary beds located on either side of the inner nuclear layer. The more superficial component of this deep complex is sometimes referred to as the intermediate plexus. These distinct vascular layers can be visualized using OCT angiography. Functionally, retinal capillaries maintain the blood-brain barrier through the presence of tight junctions. This barrier is essential for regulating the retinal microenvironment and preserving normal neural function. Finally, venous drainage of the retina occurs through the branch retinal veins, which converge to form the central retinal vein, allowing blood to exit the eye. Now let's talk about the structure of the retinal pigment epithelium, or RPE. The RPE consists of a monolayer of pigmented hexagonal cells that are derived from the outer layer of the optic cup. This layer is continuous with the pigment epithelium of both the ciliary body and the iris, reflecting their shared embryological origin. Adjacent RPE cells are joined by tight junctions near their apices. These tight junctions form the outer blood-ocular barrier, which plays a critical role in regulating the movement of substances between the choroidal circulation and the retina. Each RPE cell has a distinct apical and basal surface. The apical processes extend toward and envelop the photoreceptor outer segments, while the basal surface demonstrates rich plasma membrane infoldings, increasing surface area for metabolic exchange. Within the cytoplasm, RPE cells contain multiple spheroidal melanosomes. These melanosomes function to absorb light, reducing light scatter and protecting the photoreceptors from photooxidative damage. The accompanying figure illustrates the structural relationships of the RPE in detail. In the upper diagram, the RPE is shown interdigitating with the outer segments of rods and cones through apical processes.
melanin granules are visible within the cytoplasm, along with the centrally located nucleus. Beneath the RPE lies Bruch membrane, which separates the RPE from the choriocapillaris, shown immediately below. The lower image further emphasizes the layered relationship between the RPE, Bruch membrane, and the underlying choroidal vasculature, reinforcing the position of the RPE as an interface between the neurosensory retina and the choroid. The RPE performs several key functions that are essential for retinal health and visual function. These include absorbing light, phagocytosing rod and cone outer segments, regenerating and recycling visual pigment, and participating in retinal and polyunsaturated fatty acid metabolism. In addition, the RPE helps maintain a fluid-free subretinal space, forms the outer blood-ocular barrier, and contributes to healing and scar formation. A major physiologic role of the RPE involves photoreceptor outer segment turnover. RPE cells serve a phagocytic function by continuously ingesting shed disc membranes from photoreceptors. Over a lifetime, each RPE cell phagocytoses billions of photoreceptor outer segments. The processes of disc shedding, phagocytosis, and photoreceptor renewal follow a circadian rhythm. Rod photoreceptors shed their discs at dawn, while cone photoreceptors shed their discs at dusk. After ingestion, the phagocytosed material is gradually digested by lysosomal enzymes within the RPE cells. Together, these functions underscore the critical role of the RPE in supporting photoreceptor maintenance and long-term retinal integrity. This slide reviews the role of the retinal pigment epithelium in the visual pigment cycle. Visual pigments contain 11-cis-retinylaldehyde, which is converted to 11-trans-retinylaldehyde within the photoreceptor outer segments during phototransduction. Regeneration back to the 11-cis form occurs primarily in the retinal pigment epithelium. This cycle requires efficient bidirectional transfer of metabolites between photoreceptors and the RPE. The close metabolic coupling between these two cell types is essential for maintaining continuous visual function. The interdigitation of the RPE with photoreceptor outer segments facilitates visual pigment regeneration. This structural arrangement increases surface area and brings the cells into close proximity, thereby supporting efficient exchange of visual cycle intermediates between photoreceptors and the RPE. The RPE acts as a barrier to prevent unrestricted diffusion of metabolites between the choroid and the subretinal space. Through selective transport mechanisms, it regulates the photoreceptor environment and maintains appropriate metabolic conditions for photoreceptor function. In addition to its barrier role, the RPE has a high capacity for water transport, which prevents accumulation of subretinal fluid. RPE-mediated dehydration of the subretinal space helps modulate the bonding between the neurosensory retina and the RPE, contributing to retinal adherence and structural stability. The slide then addresses pathologic disruption of RPE function. Phagocytosis and photoreceptor renewal can be impaired by several factors, including genetic defects, drugs, vitamin A deficiency, and senescence. Physical separation of the retina from the RPE, such as occurs with retinal detachment or the presence of subretinal blood, disrupts normal metabolite exchange between these layers. Ultimately, loss or deterioration of the RPE leads to atrophy of both photoreceptors and the choriocapillaris, underscoring the critical dependence of these structures on intact RPE function. Next, we will discuss Bruch membrane. Bruch membrane lies between the RPE and the choriocapillaris. The basal surface of the RPE is directly attached to Bruch membrane, forming a critical interface between the retina and the choroidal circulation. Structurally, Bruch membrane is composed of 5 distinct layers arranged from inner to outer. These include the basement membrane of the RPE, the inner collagenous zone, the elastic fiber layer, the outer collagenous zone, and the basement membrane of the choriocapillaris endothelium. Together, these layers provide both structural support and a regulated pathway for metabolic exchange. The slide then highlights degeneration and disease relevance. With aging, Bruch membrane accumulates lipids, oxidatively damaged material, and calcium. Extensive calcification can lead to fractures within Bruch membrane, known as angioid streaks. In age-related macular degeneration, areas of calcification with associated microscopic breaks are present, further emphasizing the clinical importance of Bruch membrane integrity.
The choroidal vascularity is supplied by the posterior ciliary arteries and is organized into distinct vascular layers arranged from outer to inner. The halar layer contains large caliber vessels and is relatively thick. Beneath this lies the cellular layer, which consists of medium-sized vessels and precapillary arterioles. The innermost vascular layer is the choriocapillaris, a low-pressure capillary network that supplies the outer retina. Structurally, choroidal capillaries form a plexus posteriorly. As the choroid extends toward the periphery, the vascular arrangement becomes more irregular and radially oriented. The vascular layers are interspersed with loose connective tissue, fibroblasts, and melanocytes, contributing to the overall architecture of the choroid. Venous drainage of the choroid occurs through venules that converge into the vortex vein ampullae, which then drain into the superior and inferior ophthalmic veins. Typically, there are 4 to 5 vortex veins, and these exit the eye at or posterior to the equator. The accompanying scanning electron micrograph illustrates the choroidal vascular layers in detail. Large arteries are labeled with A, veins are labeled with V, and the choriocapillaris is labeled CH, visually demonstrating the relative size and organization of the different vascular components described in the text. Choroidal thickness decreases from posterior to anterior. In the central macula, the thickness is approximately 0.22 millimeters, compared with about 0.1 millimeters at the ora serrata. On spectral domain OCT, subfoveal choroidal thickness in an individual around 50 years of age measures approximately 287 micrometers. Choroidal thickness varies with both age and disease. A relatively thin choroid is referred to as a leptochoroid, whereas a thickened choroid is termed a pachychoroid. From a physiologic standpoint, the choroid plays a critical role in nourishing the retina. It supplies approximately 90% of the retinal oxygen, primarily to the photoreceptors. The retina has one of the highest metabolic rates per gram of tissue in the human body, and the choroid supports these demands by providing the highest blood flow per unit weight of any tissue. As a result, venous blood leaving the choroid remains highly oxygenated. In addition to oxygen delivery, rapid choroidal blood flow functions as a heat sink, dissipating thermal energy generated by light absorption. The retinal pigment epithelium adjacent to the choriocapillaris is therefore exposed to very high oxygen tension, which increases susceptibility to oxidative damage. Lastly, we will end this discussion on the sclera, focusing on its composition, anatomy, permeability, and clinical implications. The sclera is composed primarily of collagen, with relatively few elastic fibers embedded within a proteoglycan matrix. It terminates anteriorly at the histologic limbus. The sclera has a non-uniform thickness. It is thinnest just posterior to the rectus muscle insertions and thickest at the posterior pole surrounding the optic nerve head. Under normal conditions, the sclera is permeable to molecules in both directions, making it an important pathway for fluid movement. Up to 40% of aqueous humor exits the eye through uveoscleral outflow, highlighting the functional significance of scleral permeability. Finally, the sclera has important implications for drug delivery. Its permeability allows for sub-T non-drug delivery. The scleral tissue is hydrophilic, which results in variable permeability to hydrophobic or amphiphilic drugs. These properties make the sclera an important consideration in the planning of periocular pharmacological injections. This wraps up Chapter 1. In this chapter, we reviewed the key anatomic structures of the posterior segment and their functional relationships, from the vitreous and retina to the RPE, choroid, and sclera. This foundational framework will support understanding of retinal physiology and the pathophysiology of retinal disease in subsequent chapters. See you in the next chapter.